Question 1. You are working as an animal technician in a veterinary practice and you are assigned to manage the nutritional needs of a group of dogs with different health conditions. One dog has been diagnosed with kidney disease, another with diabetes, and a third with obesity. What would be the most appropriate dietary plan for these three dogs to ensure their specific health conditions are addressed? A. All dogs should be given the same standard diet with high protein kibble. B. The dog with kidney disease should be given a low protein, low phosphorus diet, and the diabetic dog should be fed a diet high in fiber and low in simple sugars, and the obese dog should be given a weight control diet with a reduced calorie intake. C. The dog with kidney disease should be given a high protein, high sodium diet, and the diabetic dog should be given a high diet, and the obese dog should be given a high carbohydrate diet. D. All dogs should receive a low-fat, high-calcium diet to prevent any complications. Answer B. The dog with kidney disease should be given a low-protein, low-phosphorus diet, and the diabetic dog should be fed a diet high in fiber and low in simple sugars, and the obese dog should be given a weight control diet with a reduced calorie intake. Explanation: in animal nutrition, each condition requires a tailored approach to minimize further complications. Kidney disease in dogs often requires a diet low in protein, phosphorus, sodium to reduce the burden on the kidneys. A specialized renal diet would help manage this condition. Diabetic dogs benefit from a high-fiber diet to control blood glucose levels and prevent insulin spikes. Foods with simple sugars should be avoided as they can cause rapid blood sugar fluctuations. Obesity in dogs requires a calorie-controlled diet to help with weight management, often including low fat content and increased fiber to promote satiety. It's critical to adjust the nutritional plan to fit the dog's specific needs, following veterinary guidance and dietary guidelines. Question 2. In a veterinary clinic, a dog is being treated for an acute bacterial infection. You are tasked with administering antibiotics to the dog. Which of the following is the best practice when administering antibiotics to ensure that they are effective and reduce the risk of antimicrobial resistance? A. Administer antibiotics only when symptoms are severe and stop the medication as soon as the symptoms subside. B. Administer the full course of antibiotics as prescribed even if the dog appears to recover before completing the medication. C. Use a broad-spectrum antibiotic without considering the specific pathogen causing the infection. D. Discontinue the antibiotic regimen if the dog begins to show any side effects or signs of regardless of the infection's status. Answer B. Administer the full course of antibiotics as prescribed even if the dog appears to recover before completing the medication. Explanation: antibiotics must be administered as prescribed to ensure their effectiveness and reduce the risk of antimicrobial resistance. Stopping the antibiotic course prematurely, even if the dog seems to recover, may not completely eradicate the bacteria, allowing any remaining pathogens to develop resistance. Administering the full prescribed course ensures that all bacteria are eliminated and prevents the development of resistant strains. Broad-spectrum antibiotics should only be used if necessary and when the specific pathogen is unknown, as targeted antibiotics based on diagnostic testing are preferred. This practice follows veterinary best practices and international guidelines for antimicrobial stewardship. Question 3. Scenario-based. Mr. Thompson is a pet owner who has recently adopted a rescue dog, a medium-sized breed. The dog has a history of anxiety and has exhibited behavioral problems such as excessive barking and destructive chewing when left alone. Mr. Thompson is seeking advice on how to manage the dog's anxiety and improve its behavior. What should Mr. Thompson consider as the best course of action to address these issues? The principles of animal behavior and training. A. Mr. Thompson should consider using punishment-based training to discourage the dog's anxiety-driven behaviors. B. Mr. Thompson should increase the dog's exercise routine and provide environmental enrichment, as well as consider positive reinforcement training to encourage calm behavior. C. Mr. Thompson should ignore the dog's behavior and allow it to self-regulate, as this is the best way to teach independence. D. Mr. Thompson should roam the dog, as anxiety is permanent and unmanageable condition in rescue dogs. Answer B. Mr. Thompson should increase the dog's exercise routine and provide environmental enrichment, as well as consider positive reinforcement training to encourage calm behavior. Explanation: managing anxiety in dogs requires holistic and compassionate approach. Increasing physical exercise is crucial to help reduce excess energy that may contribute to anxiety-related behaviors. Environmental enrichment, such as puzzle toys, interactive and safe spaces, can help alleviate boredom and stress, which are common causes of destructive behavior. Positive reinforcement training, rewarding calm behavior, is effective in encouraging desirable actions while avoiding punishment, which can exacerbate anxiety or fear-based behavior. Rehoming should not be the immediate solution, as many rescue dogs can improve with consistent training and behavioral management. The combination of these strategies aligns with animal welfare and ethical care practices. This approach follows the principles of humane behavior modification techniques and enhances the psychological well-being of the animal. Question 4. You are working in an animal care facility and are responsible for the management of a group of rabbits. The rabbits are housed in a shared enclosure, and one of them begins exhibiting signs of aggression, such as lunging at the other rabbits and causing stress in the group. What would be the most appropriate course of action to manage this behavior while ensuring the welfare of all the animals? A. Isolate the aggressive rabbit immediately, but ensure it is placed in an environment that causes further stress. B. Ignore the behavior and allow the rabbits to resolve the conflict themselves, as this is part of their natural social interaction. C. Gradually separate the aggressive rabbit from the group, provide enrichment to reduce stress, and monitor interactions during reintroduction. D. Introduce new rabbits to the group to help calm the aggressive rabbit, distract it from its behavior. Answer. C. Gradually separate the aggressive rabbit from the group, provide enrichment to reduce stress, and monitor interactions during reintroduction. Explanation. Aggression among rabbits can be caused by territorial behavior, stress, or competition for resources. The best approach is to carefully manage the situation to ensure the well-being of all rabbits. Isolating the aggressive rabbit is necessary, but it's important to do so in a low-stress environment that promotes calmness, not one that adds to the rabbit's anxiety. Ignoring the behavior may result in injury or prolonged stress for the other rabbits, which can affect their overall health. Gradually separating the aggressive rabbit and then reintroducing it in a controlled manner can allow time for the group dynamics to settle down. Providing enrichment, such as hiding food or objects to explore, helps to reduce stress and prevent further aggression. Introducing new rabbits may make the situation worse, as it can create more stress and territorial behavior. This approach aligns with proper animal husbandry and behavioral management principles. Question 5. A veterinary technician is tasked with administering an injection to a cat. What is the correct technique for safely and effectively administering an intramuscular IM injection in a cat, ensuring the safety of both the animal and the handler? A. Insert the needle at a 45-degree angle, hold the syringe at an angle to the skin and administer the injection rapidly. B. Insert the needle at a 90-degree angle, ensuring the entire needle is fully submerged in the muscle, and inject slowly. C. Insert the needle at a 45-degree angle, aspirate to check for blood, and administer the injection rapidly. D. Insert the needle at a 15-degree angle, withdraw the plunger immediately to confirm the muscle, and inject slowly. Answer. B. Insert the needle at a 90-degree angle, ensuring the entire needle is fully submerged in the muscle, and inject slowly. Explanation. Administering an intramuscular IM injection requires precise technique to avoid causing injury or discomfort to the animal. A 90-degree angle is ideal for IM injections, as it ensures the needle is directed perpendicularly into the muscle, avoiding the subcutaneous layer. The syringe should be held steady. Injections should be administered slowly to allow the medication to disperse evenly in the muscle. Injecting too quickly can cause irritation and discomfort. Aspirating the syringe to check for blood is necessary when administering an intravenous Roman injection, but is not required for IM injections. The angle of insertion should be neither too shallow nor too steep, as this could cause tissue damage or improper drug delivery. This method is consistent with best practices in veterinary injections and aligns with proper clinical techniques. Question 6. A laboratory technician is conducting a necropsy on a rabbit and notices signs of a parasitic infection in the intestines. What steps should the technician take to ensure proper handling of the sample for diagnosis and to minimize the risk of zoonotic transmission? A. Immediately dispose of the sample in the general waste bin and disinfect the work area. B. Handle the sample with bare hands to ensure quick identification and submit it for diagnostic testing without any precautions. C. Use personal protective equipment, PPE, including gloves and face protection while handling the sample, and properly package it for laboratory testing. D. Wash hands thoroughly before handling the sample and proceed with any further precautions, as parasitic infections are not zoonotic. Answer. C. Use personal protective equipment, PPE, including gloves and face protection while handling the sample, and properly package it for laboratory testing. Explanation. Handling animal samples, especially those suspected of being contaminated with parasites, requires strict safety protocols to minimize the risk of zoonotic disease transmission. Parasitic infections can be zoonotic, so using personal protective equipment (PPE). This gloves, face protection, and gowns is essential to protect the technician. The sample should be carefully packaged and labeled for diagnostic testing to confirm the type of parasite, and it should be sent to a laboratory with the appropriate precautions. Immediate disposal without proper testing would hinder diagnostic efforts, and bare hand handling is unsafe. Thorough hand washing is important, but it should not replace the use of proper PPE when handling infectious material. These measures are in line with standard laboratory protocols and zoonotic disease prevention guidelines. Question 7. Mr. Harris, a veterinary technician, is treating a dog with a chronic illness. The dog is being prescribed multiple medications, including corticosteroids. Mr. Harris notices that the dog is becoming more lethargic and its appetite has decreased. Which of the following actions should Mr. Harris take to address the situation? A. Continue administering the medications as prescribed and monitor the dog's condition closely. B. Stop all medications immediately and report the symptoms to the veterinarian. C. Increase the dosage of corticosteroids to counteract the lethargy. D. Begin administering different type of corticosteroid to avoid side effects. Answer: A. Continue administering the medications as prescribed and monitor the dog's condition closely. Explanation: when managing chronic illness with medications like corticosteroids, it is crucial to follow the prescribed dosage and continue monitoring for side effects. Lethargy and appetite changes can be side effects of corticosteroids, but these medications are necessary for controlling the chronic illness. Continuing the prescribed treatment while monitoring the dog's condition is the appropriate course of action. Stopping medication suddenly without veterinary approval could worsen the dog's condition or result in withdrawal symptoms. Increasing the corticosteroid dosage may exacerbate side effects like lethargy or loss of appetite. Switching to different corticosteroid is not recommended without veterinarian's guidance, as the prescribed medication has been tailored to the dog's needs. Monitoring, communicating with the veterinarian is essential to adjust treatment as necessary while maintaining the dog's health. This aligns with best practices in veterinary care and patient management. Question 8. In an animal care facility, a technician is tasked with managing the welfare of a group of guinea pigs. The facility is experiencing a rise in humidity, and the guinea pigs begin showing signs of respiratory distress. What would be the best course of action to address this situation and ensure the health of the animals? A. Immediately increase the room temperature to help the guinea pigs adjust to the humidity levels. B. Remove the guinea pigs from the affected environment and place them in a well-ventilated, dry area with a controlled temperature. C. Spray the guinea pigs with water to cool them down and help alleviate respiratory distress. D. Allow the guinea pigs to remain in the same environment and monitor them for worsening symptoms. Answer: B. Remove the guinea pigs from the affected environment and place them in a well-ventilated, dry area with a controlled temperature. Explanation: guinea pigs are highly sensitive to environmental changes, particularly humidity, which can lead to respiratory distress. Excess humidity can promote the growth of mold and bacteria, further exacerbating respiratory problems. The best approach is to relocate the guinea pigs to a well-ventilated area. Controlled temperature and humidity to reduce stress and improve airflow. Increasing the room temperature could worsen the respiratory symptoms and add additional stress. Spraying water on the guinea pigs is not appropriate, as it could further stress the animals or worsen their condition. Simply monitoring the animals without addressing the environmental factors could lead to worsening health. This practice ensures that the guinea pigs' health and well-being are prioritized in line with appropriate animal welfare standards. Question 9. A veterinary clinic is preparing for a surgery involving a cat that has been diagnosed with a heart murmur. What pre-surgical considerations should the veterinary team take into account before proceeding with the operation? A. Proceed with the surgery without any special precautions, as heart murmurs do not significantly affect anesthesia. B. Perform additional diagnostic tests, such as an echocardiogram, to assess the severity of the heart murmur and adjust anesthesia protocols accordingly. C. Administer a sedative to the cat immediately before surgery to prevent complications from the heart murmur. D. Avoid any surgery and recommend euthanasia due to the murmur, as it is an irreversible condition. Answer: B. Perform additional diagnostic tests, such as an echocardiogram, to assess the severity of the heart murmur and adjust anesthesia protocols accordingly. Explanation: A heart murmur in a cat indicates a potential underlying cardiac issue that could complicate anesthesia and surgery. Before proceeding with surgery, the veterinary team should perform further diagnostic testing, such as an echocardiogram, to assess the severity and type of heart murmur. Based on the results, the anesthesia protocol can be adjusted to minimize risks, as certain anesthetic agents may affect cardiovascular function. Simply administering sedatives without addressing the underlying heart condition could cause complications during surgery. Recommending euthanasia is unnecessary unless the heart condition is severe and unmanageable, which can only be determined after proper diagnostic assessment. This approach with responsible veterinary care and ensures patient safety during surgical procedures. Question 10. A technician is asked to prepare an intravenous Romaner catheter for a dog undergoing surgery. Which of the following steps is crucial in ensuring the catheter is properly placed and functional before surgery begins? A. Apply a bandage to the catheter insertion site immediately after placement to prevent infection. B. Ensure the catheter is placed in a peripheral vein and confirm patency by gently flushing the catheter with saline solution. C. Use a needle with a larger gauge than recommended to ensure faster medication delivery. D. Leave the catheter open to air after placement to allow for proper oxygen flow to the site. Answer. B. Ensure the catheter is placed in a peripheral vein and confirm patency by gently flushing the catheter with saline solution. Explanation. Proper placement and patency with aortic catheter are critical for successful intravenous fluid administration and medication delivery. A peripheral vein should be selected for easy access and to minimize complications, and the catheter's patency should be confirmed by gently flushing it with saline solution. Ensure it is functioning correctly. Applying bandage too early may interfere with monitoring or adjustment of the catheter. Larger gauge needle may cause trauma to the vein and is unnecessary for most procedures. Leaving the catheter open to air increases the risk of infection and contamination, so it should be covered after confirming placement and function. Question 11. A dog has recently undergone surgery for a broken leg. The technician notices that the dog is licking the surgical site excessively and appears to be in pain. What should the technician do to address this situation? A. Ignore the licking as it is a natural behavior and does not pose a risk to the healing process. B. Place an Elizabethan collar on the dog to prevent further licking and ensure that pain management is provided as prescribed. C. Allow the dog to continue licking, as this will help keep the wound clean. D. Apply a topical ointment to the wound to prevent infection and encourage the dog to stop licking. Answer. B. Place an Elizabethan collar on the dog to prevent further licking and ensure that pain management is provided as prescribed. Explanation. Excessive licking can lead to complications such as wound infection, delayed healing, or opening of the surgical site. An Elizabethan collar cone is a useful tool to prevent the dog from licking or biting the surgical site, helping ensure proper healing. Pain management is critical post-surgery. Technician should ensure the dog is receiving the prescribed pain relief to reduce discomfort and prevent behavior like licking due to distress. Allowing licking or applying topical ointments without veterinary approval could cause harm or interfere with the healing process. Question 12. A technician is tasked with administering a vaccination to a ferret. What is the most appropriate site for injection in this animal? A. The intradermal area of the skin near the neck. B. The subcutaneous tissue on the back between the shoulder blades. C. The intramuscular area of the thigh muscle. D. The abdominal cavity near the rib cage. Answer. B. The subcutaneous tissue on the back between the shoulder blades. Explanation. In ferrets, the most common and recommended site for subcutaneous SQ injections, including vaccinations, is the skin between the shoulder blades. The subcutaneous space is the preferred location for vaccine administration due to ease of access and reduced risk of complications. Intradermal, intramuscular, and abdominal injections are less commonly used for vaccinations in ferrets and may cause unnecessary trauma to the animal. This approach ensures the safe and effective administration of vaccines to ferrets. Question 13. You are working with a group of chickens and notice that one of them is exhibiting signs of sudden weight loss, lethargy, and a decreased appetite. Upon closer inspection, the chicken also shows signs of pale comb and wattle. What should you suspect, and what is the recommended action? A. The chicken may be suffering from a parasitic infestation. You should immediately administer an antiparasitic medication. B. The chicken may have a bacterial infection. You should isolate it and begin antibiotic treatment. C. The chicken may be suffering from anemia likely due to internal parasites and you should isolate it and arrange for a veterinarian to conduct fecal analysis. D. The chicken is likely experiencing normal molting. Action is required as this is a common occurrence. Answer C. The chicken may be suffering from anemia likely due to internal parasites and you should isolate it and arrange for a veterinarian to conduct fecal analysis. Explanation. Signs such as weight loss, lethargy, decreased appetite, and pale comb will often indicate anemia, which in poultry is frequently caused by internal parasites like coccidia or worms. Internal parasites can cause significant health problems, including anemia, and should be treated promptly. Isolation is important to prevent the spread of potential infections, and fecal analysis is needed to identify the type of parasite and determine the appropriate treatment. Antibiotics may not be effective if the cause is parasitic rather than bacterial, and molting does not typically cause such pronounced symptoms. This approach aligns with best practices in poultry care and ensures appropriate diagnosis and treatment. Question 14. A technician is preparing for a routine dental cleaning on a dog. What is the most important factor to ensure the procedure is successful and safe for the dog? A. Use a gentle approach and avoid the use of anesthetic to minimize the risk of complications. B. Ensure the dog is under general anesthesia and maintain adequate monitoring throughout the procedure. C. Administer antibiotics before the procedure to prevent potential infection from the dental cleaning. D. Perform the cleaning without the use of tools to avoid causing trauma to the gums. Answer. B. Ensure the dog is under general anesthesia and maintain adequate monitoring throughout the procedure. Explanation. Dental cleanings in dogs typically require general anesthesia to ensure that the dog remains still and relaxed while the technician or veterinarian performs the cleaning. Anesthesia allows for a thorough cleaning, especially in difficult-to-reach areas, and helps avoid stress and injury to the dog. Monitoring of vital signs is crucial during anesthesia to ensure the dog's safety throughout the procedure. Antibiotics may be recommended if there is an existing infection, but they are not routinely administered before every dental cleaning. Performing the procedure without anesthesia or appropriate tools would be ineffective and could cause significant harm to the dog's gums and teeth. Following proper protocols ensures the safety and effectiveness of the dental cleaning. Question 15. A technician is administering a subcutaneous injection to a cat. Which of the following techniques will help minimize the risk of tissue irritation at the injection site? A. Inject the medication as quickly as possible to minimize the time the needle is in place. B. Ensure the needle is inserted at a 90-degree angle to the skin to ensure proper absorption. C. Massage the injection site gently after administering the medication to promote absorption. D. Use a large needle gauge to reduce the amount of resistance when injecting the medication. Answer. C. Massage the injection site gently after administering the medication to promote absorption. Explanation. Massaging the injection site gently helps distribute the medication more evenly and promotes absorption. Injecting quickly can cause discomfort or tissue trauma, especially with viscous medications. A 45-degree angle is typically used for subcutaneous injections, not 90 degrees, to ensure the needle is properly placed. Subcutaneous tissue without puncturing too deeply. A large needle gauge may cause unnecessary tissue damage and pain, particularly in small animals like cats. Gentle massages, a common technique to minimize irritation and discomfort after subcutaneous injections. Question 16. You are working in a veterinary clinic and a dog has been brought in after eating a large quantity of chocolate. What is the first step in managing the situation? A. Induce vomiting immediately to prevent further absorption of chocolate toxins. B. Administer activated charcoal to bind the chocolate toxins in the stomach. C. Observe the dog for signs of toxicity and wait for the symptoms to develop. D. Provide the dog with a large amount of water to flush the toxins out. Answer A. Induce vomiting immediately to prevent further absorption of chocolate toxins. Explanation. Chocolate toxicity in dogs is caused by theobromine and caffeine, both of which can lead to severe symptoms, including seizures or cardiac issues. Inducing vomiting as soon as possible is essential to remove the chocolate from the stomach and prevent further absorption of the toxins. Activated charcoal is useful for binding toxins, but it is typically administered after vomiting has been induced to help reduce further absorption if vomiting does not eliminate all of the chocolate. Waiting for symptoms to develop is not an appropriate response, as quick action is crucial for successful treatment. Giving water may help dilute the toxins but will not significantly prevent their absorption in the digestive system. Question 17. A horse is showing signs of colic, including pawing at the ground, rolling, and excessive sweating. The technician should take which of the following actions as the first step in addressing the issue? A. Immediately administer painkillers to relieve discomfort. B. Place the horse in a confined area and monitor its condition closely. C. Feed the horse small amounts of hay to help move its bowels. D. Administer an enema to relieve any possible constipation. Answer. B. Place the horse in a confined area and monitor its condition closely. Explanation. Colic can be caused by a number of issues ranging from mild to severe and may require immediate veterinary intervention. Placing the horse in a confined area allows for close monitoring of its condition. If symptoms worsen or do not improve, veterinary assistance can be sought promptly. Administering painkillers without knowing the cause of the colic may important symptoms, making diagnosis more difficult. Feeding small amounts of hay or administering an enema should not be done without veterinary guidance, as it could worsen the condition if the cause is something like a blockage or twisted gut. Question 18. A rabbit is presented to the clinic with a history of diarrhea, lethargy, and a decrease in appetite. Upon examination, the rabbit is also showing signs of bloating. What is the most likely diagnosis and what should be done first? A. The rabbit is likely suffering from gastrointestinal stasis, and the first step should be to provide fluids and encourage motility. B. The rabbit has a bacterial infection and antibiotic treatment should be initiated immediately. C. The rabbit may have a fungal infection and antifungal medication should be administered. D. The rabbit has a respiratory infection and the primary treatment should involve administering oxygen. Answer A. The rabbit is likely suffering from gastrointestinal stasis and the first step should be to provide fluids and encourage motility. Explanation. Gastrointestinal stasis is a common condition in rabbits that often results in lethargy, diarrhea, and bloating. It can be caused by a variety of factors, including stress, diet changes, or inadequate fiber intake. The immediate goal is to provide fluids to prevent dehydration and to encourage motility with medications that stimulate the gastrointestinal system. Antibiotics, antifungal medications, and oxygen therapy are not indicated unless there is evidence of a secondary infection or respiratory issue. Prompt management of gastrointestinal stasis is essential to avoid further complications like bloat or GI blockages. Question 19. A technician is preparing to take a blood sample from a horse for diagnostic testing. What is the most common site for venipuncture in a horse? A. The jugular vein. B. The cephalic vein. C. The femoral vein. D. The saphenous vein. Answer A. The jugular vein. Explanation. The jugular vein is the most commonly used site for venipuncture in horses due to its size and accessibility. It is relatively easy to locate and has a low risk of complications when performed correctly. The cephalic, femoral, and saphenous veins are not typically used for blood collection in horses, as they are less accessible or smaller, making them more challenging to sample. The jugular vein is preferred large animals like horses because it allows for efficient and safe blood collection. Question 20. You are working in an animal care facility and you are tasked with administering an intramuscular injection to a dog. Which of the following is the correct procedure for administering the injection safely? A. Inject the medication into the gluteal muscle for faster absorption. B. Use a large bore needle to ensure the medication is administered quickly. C. Insert the needle at a 45-degree angle and aspirate before injecting. D. Inject the medication into the muscle slowly to reduce pain at the injection site. Answer D. Inject the medication into the muscle slowly to reduce pain at the injection site. Explanation. Injecting slowly into the muscle helps minimize pain and tissue trauma, as rapid injection can lead to irritation. The gluteal muscle is not commonly used for arm injections in dogs, as it may cause more discomfort or injury. The preferred sites are the quadriceps or the apexial muscles along the back. Using a large bore needle may the risk of causing unnecessary damage to the tissue and should be avoided unless necessary. Aspiration before injecting is not typically recommended in intramuscular injections, as the needle is unlikely to enter a blood vessel, especially in muscles like the quadriceps. Question 21. A cat is diagnosed with feline leukemia virus FeLV. What is the most effective measure to prevent the spread of this virus in a shelter environment? A. Isolate infected cats and avoid contact with other cats. B. Administer antibiotics to all cats in the shelter to prevent secondary infections. C. Vaccinate all cats in the shelter, even those not showing symptoms. D. Use antiviral medications to treat all infected cats in the shelter. Answer A. Isolate infected cats and avoid contact with other cats. Explanation. FeLV is highly contagious among cats, and the most effective way to prevent its spread is through isolation. Infected cats should be housed separately from healthy cats to avoid transmission through saliva, nasal secretions, or other bodily fluids. Antibiotics are not effective against viral infections like FeLV and will not prevent its spread. While vaccination can prevent FeLV in cats that are not already infected, it is not effective for cats already diagnosed with the virus. Antiviral medications have limited efficacy for FeLV and should not be relied upon as the primary means of preventing transmission. Question 22. During a routine examination, a technician notices a small mass on a dog's abdomen. The mass is firm, non-mobile, and has irregular borders. What is the most appropriate action to take next? A. Immediately perform a biopsy to determine the nature of the mass. B. Monitor the mass for any changes and schedule a follow-up examination in a few weeks. C. Recommend that the mass be surgically removed without further investigation. D. Perform a fine needle aspiration FNA to obtain a sample for cytology before making further decisions. Answer D. Perform a fine needle aspiration FNA to obtain a sample for cytology before making further decisions. Explanation. A fine needle aspiration (FNA) is a non-invasive technique used to obtain a sample from the mass for cytological examination, which can help determine whether the mass is benign or malignant. Performing a biopsy may be premature and invasive without first obtaining a sample to better understand the nature of the mass. Monitoring the mass for changes is not recommended in this case, as the irregularities in size, shape, and mobility may suggest malignancy, and timely diagnosis is critical. Surgery should not be considered without further diagnostic workup, as the mass may not need to be removed, or additional procedures may be required if it is malignant. Question 23. A horse is suffering from a mild case of colic with symptoms including pouring, mild abdominal discomfort, and rolling. The veterinarian recommends allowing the horse to walk. Why is walking beneficial for this condition? A. Walking increases blood flow to the gastrointestinal tract, helping to relieve discomfort and encourage motility. B. Walking allows the horse to rest and conserve energy, preventing further stress on the body. C. Walking helps the horse to digest food faster, preventing further impaction. D. Walking allows the horse to expel gas from the stomach, relieving bloating and discomfort. Answer A. Walking increases blood flow to the gastrointestinal tract, helping to relieve discomfort and encourage motility. Explanation. Walking promotes circulation and increases blood flow to the gastrointestinal tract, which can help relieve the discomfort associated with colic. The movement also encourages motility in the intestines, which is important for resolving mild colic symptoms. Resting and conserving energy is important for severe. But in mild colic, walking is generally recommended to stimulate digestion and promote the passage of gas and material in the intestines. While walking may help move the horse's digestive system along, it does not directly aid in food digestion or impaction. Walking can help expel gas, but the main benefit is the stimulation of gastrointestinal motility to prevent further discomfort. Question 24. A technician is tasked with performing a pre-surgical assessment for a dog scheduled for spaying. Which of the following findings would most likely delay the procedure or require special consideration by the veterinarian? A. The dog has a slight increase in body temperature, 103 Dec. B. The dog is slightly overweight but otherwise healthy. C. The dog has history of mild food allergies but no current symptoms. D. The dog is showing signs of mild dehydration. Answer D. The dog is showing signs of mild dehydration. Explanation. Mild dehydration can increase the risks associated with anesthesia and surgery. It is essential to address dehydration before proceeding with the procedure, as it may impair kidney function, reduce the effectiveness of anesthesia, and affect the dog's overall recovery. An increase in body temperature can indicate an underlying infection, but 103 Dec may not necessarily do the procedure if the dog is otherwise healthy. Veterinarian would assess this further. Being slightly overweight is consideration, but not significant reason to delay surgery unless it affects anesthesia dosing or overall health. Mild food allergies are usually not an issue for surgery, especially if the dog is not currently symptomatic. It is always important to inform the veterinarian of allergies, but they are unlikely to delay surgery. Question 25. A rabbit is presented with signs of severe lethargy, weight loss, and poor coat condition. The veterinarian suspects a gastrointestinal problem. Which of the following is the most likely diagnosis? A. Gastrointestinal stasis. B. Canine parvovirus infection. C. Feline infectious peritonitis. D. Equine encephalitis. Answer A. Gastrointestinal stasis. Explanation: gastrointestinal stasis is a common condition in rabbits where the normal motility of the gastrointestinal tract slows down or stops. This leads to lethargy, weight loss, and poor coat condition due to malnutrition and dehydration. Canine parvovirus is a disease affecting dogs, not rabbits. Feline infectious peritonitis affects cats and presents differently. Equine encephalitis is a disease of horses and does not fit the symptoms presented in the rabbit. Question 26. A ferret is brought in for an annual checkup, and a veterinarian notices a thickened, inflamed area around the ferret's anus. Upon further examination, the veterinarian suspects a condition involving the anal glands. What is the most appropriate next step? A. Administer an antibiotic injection to treat any potential infection. B. Express the anal glands to relieve the discomfort. C. Schedule the ferret for immediate surgery to remove the anal glands. D. Recommend a special high-fiber diet and monitor for improvement. Answer B. Express the anal glands to relieve the discomfort. Explanation: anal gland impaction is a common issue in ferrets, and expressing the glands manually can relieve the discomfort and prevent infection or further complications. Antibiotics might be necessary if there is a secondary infection, but the primary issue is likely impaction, which can be addressed by expressing the glands first. Surgery to remove the anal glands is a last resort and not typically required unless there are recurrent issues. A high-fiber diet is often recommended to help prevent anal gland problems, but immediate action is needed to relieve discomfort in the present case. Question 27. A parrot is presented to the clinic with difficulty breathing, a wheezing sound, and a decreased appetite. The veterinarian suspects a respiratory infection. Which of the following diagnostic tests would be most appropriate to confirm the diagnosis? A. Fecal exam for parasites. B. Radiographs of the thorax. C. Blood smear to check for anemia. D. Urinalysis to check for kidney disease. Answer B. Radiographs of the thorax. Explanation: radiographs of the thorax, chest X-rays, would be the most appropriate diagnostic tool to evaluate the respiratory system and identify signs of infection, fluid buildup, or other abnormalities in the lungs. A fecal exam is used for detecting intestinal parasites, which are not related to respiratory symptoms. A blood smear may be useful for other conditions, but it wouldn't provide direct insight into the respiratory problem. Urinalysis is primarily used to assess kidney function, not respiratory issues. Question 20. A cat is presented with signs of vomiting, diarrhea, and lethargy after being introduced to a new brand of food. Which of the following is the most likely cause of these symptoms? A. Food intolerance or allergy. B. Ingestion of a toxic substance. C. Panleukopenia virus infection. D. Intestinal obstruction. Answer A. Food intolerance or allergy. Explanation: food intolerance or allergies are common causes of gastrointestinal upset in cats, especially after a sudden change in diet. The symptoms of vomiting, diarrhea, and lethargy fit with this cause. Ingestion of a toxic substance could cause similar symptoms, but the history of a new food suggests that food intolerance is more likely. Panleukopenia virus typically causes severe symptoms including fever, dehydration, and a more rapid progression of illness. Intestinal obstruction is unlikely to be caused solely by food changes and would more commonly present with more severe symptoms like inability to pass, stool, or significant abdominal distension. Question 29. A dog is presented with chronic itching, hair loss, and skin infections. The veterinarian suspects a problem with the dog's immune system. Which of the following conditions is most likely? A. Hypothyroidism. B. Atopic dermatitis. C. Pyoderma. D. Systemic lupus erythematosus. Answer B. Atopic dermatitis. Explanation: atopic dermatitis is a common immune-mediated skin disease in dogs that causes chronic itching, hair loss, and skin infections. It is often triggered by environmental allergens such as pollen, dust mites, or mold. Hypothyroidism can cause hair loss and skin changes, but is typically not associated with chronic itching or infections. Pyoderma refers to a bacterial skin infection that could be a secondary result of atopic dermatitis, but it is not the primary underlying cause. Systemic lupus erythematosus is a rare autoimmune disease that can cause skin lesions, but it typically has more widespread symptoms affecting multiple organ systems. Question 30. A kin is presented with a distended abdomen, poor appetite, and a history of poor growth. Upon palpation, The abdomen feels firm and bloated. What is the most likely cause of these symptoms? A. Intestinal parasites. B. Feline leukemia virus, valve infection. C. Congenital liver shunt. D. Abdominal tumor. Answer A. Intestinal parasites. Explanation: intestinal parasites, such as roundworms or hookworms, are a common cause of a distended abdomen, poor appetite, and failure to thrive in kittens. The bloating results from the parasites inhabiting the intestines and causing an obstruction or malabsorption. Feline leukemia virus, FeLV, can cause weight loss and poor growth, but typically does not cause abdominal distension. A congenital liver shunt can cause poor, but would typically not present with a bloated abdomen. An abdominal tumor is less likely in a young kitten and would typically present with other signs of illness or weight loss.